This will be a full evaluation of a middle and lower thoracic segment. For argument's sake, we're going to use the T7 segment in the seated position. To locate the T7 spinous process, I'm going to bisect the inferior angles of the scapula, coming to the midline. To fully evaluate a thoracic segment, we're going to assess both flexion and extension, right and left lateral bending, right and left lateral flexion, and then we're also going to assess elevation and depression of that segment's rib pair. My segmental contact point in this maneuver for the spine proper, just like the lumbar spine, I'm going to contact the lateral aspect of the spinous process, taking the base of my thumb and spying across the inner spinous space to the one below. We're going to assess two things: joint play, the freedom of movement between two segments as I take him through movements, and end feel. The first movement I'm going to look at is going to be flexion and extension. I've done a general scan of the spine, and I feel that this is an area that needs further evaluation. To that end, I put my finger in the inner spinous space between these two segments. I'm going to have the patient cross his arms over his torso. And once again, I'm going to ask the patient to do me a favor, I'm going to have you bend forward, and come back, and come forward, and come back. I should feel freedom of movement and separation. When I bend them forward, the spinuses should open up freely. When I extend them back, they should close freely. If I find one where it does not open up freely, or does not close down any more so when I'm extending them, I can look at saying this is a problematic segment, and relatively speaking, in a motion listening system, this would be a flexion restriction. In the Gonstead system, this would be the letter P. The spinous went posterior. I'm now going to check rotation. My segmental contact point is going to be the lateral aspect of the spinous process of the one above, taking the base of my thumb and spying across the inner spinous space to the spinous process below. We're going to assess for two things: joint play, freedom of movement between the two segments, and end feel. I'm first going to bring the joint to pretension in whatever movement I want to assess, and then I'm going to lightly spring through that joint to see the normal resiliency or lack of resiliency in that particular segment in that motion. First motion I'm going to assess is left rotation. As I rotate his torso to the left, joint play is present. I feel good separation between the two spinuses. To assess end feel, I'm going to take the slack out of that joint, bringing it to pretension, in this case in left rotation, and then lightly spring through using my body weight on that superior spinous process. As I spring, I feel a degree of resiliency, and I actually feel further separation of that joint. In this case, left rotation is intact. For right rotation, I'm just going to switch to the right side of the lateral aspect of the spinous process, and I'm going to rotate his torso to the right. Once again, joint play is present. I feel separation of the two segments. And then end feel. End feel is resilient, not quite as resilient the other side, but there is a degree of resiliency in it. So relatively speaking, this is a normal joint in rotation. For lateral bending, I'm going to laterally bend the torso. The trick in lateral bending, whether you're in the lumbar spine, the mid-thoracic spine, or the middle thoracic or the lower thoracic spine, is focusing the lateral bending where your hand contact is. To that end, some general rules are, if I want lateral bending to occur in the lumbar spine, I tend to pull the torso over to get it in the middle and the lower thoracic, the middle thoracic spine. I'll tend to compress down on his shoulder. In the lower thoracic spine, you might find there's little combinations of compressing down on the shoulder and pulling the torso over. The easiest thing to do, of course, is to look at the spine, and you can kind of manipulate it as needed to put the bend where your hand contact is. To assess lateral bending, once again, I'm on the lateral aspect of the spinous process of the one above, spying across the inner spinous space of the one below. I'm going to assess joint play. In right lateral bending, joint play is present. I feel separation between the spinous processes. To assess end feel, I'm going to take the slack out. I'm going to bring that joint to pretension, in this case right lateral bending, and then lightly spring through the contacts. And it's relatively resilient, not quite as much as rotation, but there is a degree of resilience in there. To assess left rotation, I'm going to come to the other side. I'm on the lateral aspect of the spinous processes. In this case, I'm going to laterally bend his torso to the left. Joint play is present, not quite as much as rotation, but it is present. In an end feel, he's a little springier than he was in left lateral bending, in terms of right lateral bending on this side up over here. But for the most part, he's fairly resilient. So far, we've assessed flexion, extension, rotation, and lateral bending. The last thing we need to do is we need to be able to assess elevation and depression of that particular segment's rib pair. To this end, because I'm on the T7 spinous process, I can locate its rib pair, since I'm in the middle thoracic spine, by palpating superiorly 2 interspinous spaces and then over approximately 2 inches. Okay? An inch to the TVP and then another inch to the rib. Okay? An easier way to look at this really is if you take a look at the bulk of the paraspinal muscles. I'm going to slide laterally to the lateral aspect of the paraspinal group. And what I'm going to feel is I can feel his rib. My segmental contact point that I'm going to utilize is, for the initial phase, is I'm going to go to the intercostal space below. We're going to use the intercostal space the same way we use the interspinous space when dealing with the thoracic movements. As you palpate superior and inferiorly, you're going to feel the rounding or the convexity of the rib. And what we want to feel is beneath that rib, the T7 rib in this case, we want to feel the concavity of the intercostal space. I'm going to use my thumb, place it in the intercostal space such that I can feel the inferior aspect of the T7 rib and the superior aspect of the T8 rib below. To assess elevation, elevation occurs in one of 4 things. Inspiration, taking a deep breath in. Flexion of the thoracic spine will open or widen this intercostal space. Rotation away from this right side, in other words, left rotation. And left lateral bending, or contralateral lateral bending. All of these things will, in this case, increase the space or elevate the ribs or increase the rib angles. I'm going to look for 2 things. I'm going to look for joint play and end play. Do me a favor, can I have you fold your arms across your chest? As per phase work, I'm going to combine for elevation flexion. To assess elevation, I'm going to assess flexion, contralateral rotation, and contralateral lateral bending. You can just leave me by here. What I'm feeling for as I do these is I should feel that intercostal space open or widen, and it does. So joint play and elevation is present. To assess end play, I'm first going to bring the joint to pretension by flexing him, contralateral rotation, lateral bending, and then by springing predominantly I to S on the inferior aspect of that rib angle, in this case a T7. And his rib is giving. So I can say that both joint play and end feel are relatively normal. To assess depression of this rib, with my finger in that intercostal space, depression is caused by one of 4 things. Expiration, extension of the torso, I will feel the space close down, ipsilateral rotation, and ipsilateral lateral bending will all depress this rib, the T7 rib, or close that intercostal space down. So with my thumb still in that intercostal space, I'm going to assess for joint play in depression. As per phase work, I'm going to combine all 3. I'm going to both extend, ipsilateral rotate, and ipsilateral lateral bend. And what I feel is this intercostal space actually closes down. He has joint play in depression. To follow up with end play, though, to see how well the resilience of this rib in terms of depression, my segmental contact point changes from the intercostal space below to the superior aspect of the rib angle of T7. So now I'm going to take my thumb, I'm going to slide up to the superior aspect of the T7 rib. I'm going to bring the joint to pretension by extending, ipsilateral rotation and lateral bending, and springing predominantly S to I. and once again he feels fairly resilient. To complete this maneuver, of course, so I've just assessed the right side, I'd also want to assess the left side. Once again, my fingers in the intercostal space. I'm going to assess joint play and end play of both elevation and depression. Elevation and depression of that rib pair. And that would be a full evaluation of a middle or a lower thoracic segment. Flexion, extension, rotation, lateral bending of the thoracic segment proper, and then elevation and depression of its rib pairs, right and left side.